Salutations, respected viewers. I am George from Ireland, and in this video I shall be debating the motion this House would ban cosmetic surgery, and as is always the case, the opening speech will be by the proposition. So, Madam President, ladies and gentlemen of the House, this House would ban cosmetic surgery. So, first of all, the task is to define what cosmetic surgery is. Well, that's obviously an operation on a person's body, on the exterior of their body, to change its appearance. It could be on the nose, it could be on other parts of the face, you know, the cheeks, the chin, it could be on the breasts, it could be on the pudenda, it could be on the legs, any part of the body. And so how the body looks, that's what it's changing. We're not talking about internal surgery, not talking about heart surgery or any operation to cut out a cancer's growth or something like that. So it's about aesthetics. We're not opposed to surgery or operations to change people's appearance if they've suffered some terrible burns or they've been born with some disfiguring defect, such as not having a nose or things like that, or they have an extra digit that they wish to have removed. All right, so why are we against cosmetic surgery? First of all, because it's unnecessary. Second, it's dangerous. Third of all, it's very costly. And lastly, because it's a waste of resources. So I shall go over those again, one by one, and I shall expand on each of them. We don't need these operations to change our looks. They're people who look ordinary, look above average or below average in terms of their looks. We're just talking about aesthetics. Now, I know beauty's in the eye of the beholder and all that, so it's debatable what is good looking and what's considered to be physically alluring. This varies from culture to culture, varies down the centuries and person to person. So many people really have no need of this, and it's just through vanity, thinking their nose is slightly too big or too small or whatever. And there is no medical need. So if people need an operation, they should have it. But if they do not need it, they should not have it. Every operation is a risk, so don't have them unless you actually need them. And if you're unhappy with your looks for whatever reason, you should just get therapy, get counselling, and get over it that way. View it as a psychological issue. It's not a medical issue. And so there are ladies who think that their breasts aren't large enough, or indeed they're too large, or they're not so upright anymore, especially after they've had a few children, and they want them altered. But this is completely unnecessary, and they shouldn't do it. And doctors and nurses should be more ethical and simply refuse to perform completely unnecessary operations. Now, I know some people might have mental ill health issues, and it should be dealt with that way, not by giving them operations they do not need. So they're perfectly good-looking people who become fixated with this sort of thing, and they want more and more and more operations. They just don't look human anymore. They have facelifts and things like that, and they look like they're made out of formica or something. I mean, I've known women d'un certain âge who had such operations, and they look like a fridge, look like that sort of material. I thought she would be far better off looking her age, but still resembling a human and having the full range of facial expressions, being able to crease around the eyes and so forth. So I think we should get over having a wrinkle and remind ourselves that age is a privilege. A lot of people don't make it to middle age. You think down the millions of years that Homo sapiens have existed, majority of people didn't even get to 40. So we are lucky. We've got to count ourselves as very lucky to reach that age. And wrinkles, you know, that's an award for having made it so far. So you should just be grateful that you are this age and not trying to hide it and rejuvenate and be so artificial. All right, so we age naturally. It's a part of life. Accept it gratefully. Moreover, it's dangerous. Don't have operations you don't need. It can go wrong. You can look worse than you did before. The famous lips of, I can't remember who it was, Leslie Ash, for example, is an advertisement of why you shouldn't have these things. Looked far worse than she did before, looked ordinary beforehand. And it can even end in death. There was an Irish woman who flew to Poland to have breast augmentation without telling her husband to surprise him, Irish woman, and unfortunately all went wrong. She died in the operating table. A totally avoidable operation. She didn't need to do that. And anyway, boobs that have been operated on, they don't look that good anyway. They're just a bit too round. They don't move. They're unnatural. Don't like fake ones. So it's unethical to perform an operation that's not needed when it can go wrong like that. We've got to think about patient benefit and saying, oh, I'll look better. is not a benefit. All right, there are other ways you can to look better. You can go to the gym, you can use whatever beauty creams, things like that, or you can wear whatever clothes. Don't have operations. And it's very expensive. People who can't afford these things are taking out loans, or they're beggaring themselves, they're not paying their mortgage to get these operations. And there's a bit of an arms race on this. She's had this or he's had that, so I've got to have it. And it becomes more and more and more prevalent. And then children are having these operations, their parents are putting them through these operations. It's outrageous, it's sick. Society's gone very wrong when we allow this sort of thing. Moreover, it squanders medical resources. How about the people who don't get medical care, especially in less economically developed countries? Doctors, nurses, and so on, they're there to heal, not to perform completely unneeded operations on the wealthy. So they're people who are dying avoidably, and the time of doctors and nurses is wasted on these operations, which should be spent dealing with real medical issues. So for the reasons I've already outlined, I beg to oppose. Right, I'm the opposition. Madam President, ladies and gentlemen of the House, I oppose this dreadful motion for many reasons. First of all, choice. Second of all, there is a real need. Third of all, we can provide for the other real needs. And lastly, because it's actually not that expensive. So choice, it's your body, it's your choice. So you should be allowed to choose what you want to have done. And there are even people who want like limbs severed. It's a strange psychiatric phenomenon, but they sometimes get that done. So you should be able to decide what you want to do. And obviously there's some sort of ethical panel to consider these operations before we go ahead. I think they're not going to allow you to have your head attached to your hand attached to your forehead or something like that. So people are allowed to choose what they do with their body, and that's that. And the state should butt out and stop regulating these things and banning these things. And actually, there isn't a clear definition between what's disfiguring and what is just simply elective, born whatever without a nose or somehow missing a digit or indeed with an extra digit. How's that different from not having the nose you like, or the cheekbones you like, or the chin you like, or the breast you like, and things like that? I knew a young lady from Italy who's effectively had no breasts, and she really, really disliked it. She said, I wish I had something, not much, but just at least something, and it really upset her, it got to her. So why should she not have her need addressed? Or there are indeed men who have the thing which is, I'm afraid, cruelly called a micropenis. And there are all these cruel jokes about men who have this, how they're somehow inadequate. And of course, such men feel dreadful. So we should help them. We should make people feel better. And it's just spreading happiness in the world. And if doctors and nurses are willing to give their very precious time to help these people, so much the better. So healthcare is not simply about avoiding death. It's about quality of life. And that's that. And we realize there's a risk involved in any operation, and this is fully explained to patients. And if, having been made cognizant of the dangers inherent in such operations, they choose to go ahead, then of course their wishes ought to be respected. Now I realize there are exceptions for those who are mentally ill, or those who are educationally subnormal, who are adults, who are in effect children. That's a bit different. And I realize we do need to have stricter ethical guidelines for operations performed on children with the consent of their parents, to make sure that the parents aren't pushing them in for operations they don't really need. Wait till the child is turned 18, he or she is then an adult, and having reached legal majority, they can decide for themselves rather than being strong-armed by their parents. So then it just makes people happier. And if some people like surgery or like the look and want to go back for many more, go ahead, knock yourself out. That's what a free society is. It's not for the nanny state to be interfering and saying, thou shalt not, and this and that. So it becomes stealth totalitarianism, creeping forward stage by stage. So we can address people's psychological needs these ways. Sometimes surgery isn't effective, and obviously gender reassignment is part of this. So there are other medical needs, such as were pointed to by the previous speaker, but these can be addressed by obviously training more doctors and nurses and using our time a bit more sensibly, rather than sort of keeping so many psychiatric patients locked up who are just never going to get better. And we waste a doctor's time, nurses' time on loads of other things on the worried well. So it's not so expensive, the cost is coming down. We have robots to perform these surgeries increasingly, and just training more and more people to do these things. So for the reasons that I've already suggested, I beg to oppose.